Good afternoon and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with a low-country bariatric surgeon to learn about the health impacts of obesity and some of the treatment options available for those struggling with their weight.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Washington. He is a bariatric surgeon here at East Cooper Medical Center. Thanks for having me.
Thank you for having me.
Okay, first off, let's talk about this recent study that's getting a lot of buzz lately.
Yeah, it was reported in the New York Times that obesity-related cancers actually in the 25 to 45-year age group are increasing. Other cancers, such as lung cancer in that age group, is going down because not as many people are smoking, but obesity-related cancers are up, which is kind of frightening.
Because I guess now we're learning so much about how much of an impact obesity has on pretty much every aspect of your life, right?
Right. And the reason behind the obesity-related cancers is that we now know that obesity creates what we call a chronic inflammatory state in the body. And that chronic inflammatory state is what triggers the cancers in people, and particularly the cancers that we're talking about: uterine, breast, colorectal cancer, multiple myeloma, and gallbladder and pancreatic.
Oh, wow.
So those are increasing in the younger population, which is
a little scary.
Which they're all contributing to the obesity epidemic.
Okay, let's talk about obesity and what impact it has on mental health and just physical activity and things like that.
Well, we always say that obesity affects everything from the top of your head to the tips of your toes, and we are truly in an epidemic because this is 1985 in the United States, and you can see here that obesity rates in the United States in 1985 were in the range of 10 to 15%, and many states had no obesity issues. But this is the latest map that was put out by the CDC for 2017. And you can see that many of the states in this orange color have obesity rates greater than 30%. And then this very dark maroon color have obesity rates even greater than 35%. So in that short time between 1985 and 2017, obesity rates in the United States have increased precipitously.
Oh, wow. And then you just have Colorado here just hanging out, doing it right?
Colorado is the only state that doesn't seem to have a severe obesity problem.
Wow. That's a little scary, right? But at least in South Carolina, we have a few others that are worse than we are. So we always keep that in mind. Positive note for today. Okay, so what's this? What are we looking at here?
So we say, obesity is the central cause of a lot of diseases that we face today. And you can see here's cancer, as we just discussed, and gallbladder disease, and kidney disease, and stroke. And South Carolina, I don't know if you know it, but is the number one. We have the highest stroke rate in the entire country. Number one. And then heart failure, arterial sclerosis and heart disease, diabetes, which is the other epidemic that kind of rides on the back of the obesity epidemic, and hypertension. So we treat all of these diseases very well, but the central cause of many of these diseases we sometimes overlook.
It always comes back to obesity, right? Okay, so what are some of our options? How can we get a positive outlook on some of the ways that we can treat this?
Well, there are, typically diet and exercise, was the treatment of choice. And probably diet and exercise is probably a good choice for those that are not severely or what we call morbidly obese. When we say severely or morbidly obese, you can kind of get an idea. It's usually you're about, 100 pounds over your ideal body weight, okay? And diet and exercise in that category of patient fails miserably and is only probably 5% successful. So after diet and exercise, we have weight loss medications.
Okay.
And weight loss medications, there's a new brand of several new drugs that have been introduced.
So it's evolved over the years, right?
So there's been a 15-year hiatus, okay, until a new weight loss drug was introduced. And the first weight loss drug that was introduced after 15 years okay, was a drug called Belviq. And everybody was very excited about, having a new weight loss drug after having no new weight loss drugs for 15 years in the United States. But what I have to remind everybody about the newer weight loss drugs, Belviq, Contrade, Qsymia, when you looked at the FDA trials of the weight loss drugs, they only had modest improvement in weight loss. Like for instance, here it shows the control group, and they lost about 5 pounds, and the people on Belviq lost about 12 pounds. Not that much different. So when you're talking about people that are morbidly obese and 100 pounds over their ideal body weight, these weight loss drugs fail miserably. And you say to yourself, well, why did the FDA even approve them if they only had modest benefit? Well, they had, because we didn't have a weight loss drug in 15 years, and they appeared safe. They caused no harm. So if they had just a little bit of benefit, but they were pretty safe, since we had no weight loss drugs, period, for 15 years, the FDA approved a new series of weight loss drugs. But in most people that are severely and morbidly obese, they're not very effective.
So could this technically be a good option for someone, let's say they're about to go over the line of being diabetic? Right. Maybe this would push them back instead of getting close to that line?
These drugs are probably a benefit in the weight loss group with BMIs between maybe 30 and 35, that are just mildly obese.
Okay, and when you go above that, an option, bariatric surgery.
Yes. Well, just so you know, bariatric surgery is mainstream now. It used to be thought as extreme and only for those that were 500 and 600 pounds. But now bariatric surgery is done for anybody that has a BMI of basically above 35 that has associated obesity-related illness. Just so you know, bariatric surgery, it is now safer than having your gallbladder removed. And it is the most common general surgery operation done in the United States today. It used to be that gallbladder removal was the most common, and before that, hernia repair was the most common, and now bariatric surgery is the most common. So it is mainstream. It's done in a lot of volume in the United States, and there's really, if it's safer than having your gallbladder removed, it's just as safe as having a hip or a knee replacement. Why not take advantage of it? Because it's very successful. And most patients can lose between 60 and 70% of their excess weight. And if they follow up, keep it off long term.
But that still means, though, that people need to do their research and find the right doctor to do it. Because just because it's safer than they've ever, been before, right? You got to make sure you find the right doc to do it, right?
Well, you want to go to someone who actually specializes in it. And this is all I do. I only do bariatric surgery. And you want to go somewhere where they have all of the proper equipment to actually do it. And
credentials, right?
And credentials to do it.
Perfect. Okay, before we go, gastric balloon, what is that?
Well, the gastric balloon is something that is new to the United States, having been FDA approved 3 years ago, but not new to the world, having been done probably about 15 years in other places in the world. The FDA in the United States is kind of slow to approve any new product. They really want to make sure that it's safe for the United States, and therefore we're a little slower to approve medical devices than the rest of the world. But it's basically an inflatable balloon. The one that I like to use contains saline, which is just a little bit of salt water. And it's non-surgical, so no incisions. It's put in with an endoscope, and we inflate it with saline, and it takes up space in your stomach and gives you a feeling of fullness and helps you lose weight.
Have you seen good results with that?
We have seen good results for it, but again, the gastric balloon is probably for I would say somewhere the BMI range between 30 and maybe 40.
Gotcha.
Right.
All righty, well, thanks again, Dr. Washington, for being here with us today. And for more information, head online to eastcoopermedctr.com.